I'm sure at this point, you've probably heard about the deadly coronavirus that originated from Wuhan. Looking at the exponential increase in infected people along with the death rate, the virus looks pretty scary. With the amount of airplane travel going on nowadays, the virus is likely to spread to all parts of the world, having confirmed cases in the United States, Japan, Korea, Canada, and France. Today, I'll be telling you 10 things about the coronavirus that you need to know. Just a quick heads up to take this video with a grain of salt and do more research before you come to your own conclusion. Our understanding of this coronavirus might change as we learn more about it. Also, please leave a like and subscribe, and click the bell notification icon for similar videos in the future. 1. What this coronavirus does. Coronaviruses cause respiratory illness, which leads to infections in the sinuses, nose, and throat. This often causes the infected to cough and sneeze. From what we understand at the moment, the virus spreads quickly through this method. People infected with this virus initially develop cold and flu-like symptoms, such as fever, coughing, nausea, vomiting, and diarrhea. These symptoms become more violent as the virus replicates in the body. While many have suggested the lethality of this new coronavirus is eerily similar to SARS, another deadly coronavirus that killed nearly 8,000 people in 2002 and 2003, scientists think that the severity of this virus on the infected is lower, based on the death count that we have now. However, one worrying fact that the World Health Organization has noted is that this coronavirus is spreading even faster than SARS was in its first 3 weeks of outbreak. 2. It started with a bat. Similar to the SARS scenario where a horseshoe bat was the original carrier of the virus, scientists believe that the same is true with this coronavirus, where a bat or bird was the first host of the virus before it was transmitted to other animals through waste and saliva, and then to people. In the case of SARS, the horseshoe bat transmitted it to an Asian palm civet, which is a common rodent in Asia, and then it eventually spread to people. For this coronavirus, scientists believe that the middleman was likely a Chinese cobra, being sold as either food or medicine at the Wuhan marketplace, where an extremely wide variety of live animals are sold. 3. There might be a lot more people infected than we think. From what the media has told us at the time of making this video, there are 1,400 infected with this virus worldwide. However, a video has recently been posted on YouTube where a nurse in China helping to cure the coronavirus talks about how many people are actually infected. She says there are already 90,000 people infected in China. Since we already know that this virus spreads rapidly and easily through sneezing and coughing, the virus may have already made contact with millions of people at airports prior to the outbreak. While it is a possibility that this video could potentially be a hoax, the nurse looks to be wearing all the proper equipment the medical staff are wearing in the media, which would be pretty hard to get their hands on in the short time this coronavirus outbreak has started. 4. The virus is already mutating. One of the worst things about coronaviruses are their ability to mutate extremely fast. This makes it very difficult for scientists to develop treatments, because each treatment is specific to the shape or a structure on the virus. In this case, scientists believe that this coronavirus has likely mutated multiple times to jump from its carrier to the live animal and to humans. When viruses invade the cells in our body, they hijack the machinery and use it to produce more viral material to spread to other cells. During this production process, there is a chance for the genetic code to mutate. To add to that, viruses replicate extremely quickly, which means there might have already been many more mutations since the development of potential treatments. 5. It can spread without symptoms. Once the coronavirus is established, it takes roughly 14 days for the symptoms to appear. This makes it extremely difficult to tell who was infected and who isn't. During this time frame, the virus can still be spread through coughing and sneezing. As a result, the carriers of the virus are unaware of even being infected. and continue their day-to-day lives while posing a risk to everyone else. This is also likely the main reason why this virus has spread so fast, with China being a densely populated country. For example, if one person has it and that person goes to work by public transportation, think of how many other people that person could be in contact with. This is very problematic, and not just for countries in Asia. Many people in countries with confirmed cases of the coronavirus may be planning to travel to other countries in order to escape from the virus while they're already infected. 6. Cities have preventative plans in place. The majority of countries often have preventative measures against people coming in with illnesses. This includes and is not limited to a questionnaire asking if you've recently had a fever, felt ill, and heat sensors to detect fevers. However, as mentioned before, this may do little for the coronavirus because it can spread without showing symptoms. There have also been cases where people have hidden their symptoms such as fevers and coughing by taking medications beforehand such as cough suppressants and Tylenol. This is evidently shown in the coronavirus cases that are popping up in different countries. To prevent the further spread of the coronavirus, China has recently issued a Level 3 warning from the Centers for Disease Control and Prevention, which means to avoid non-essential travel. So if you don't absolutely need to go to the area, then you probably shouldn't. There is also a Level 1 warning for the rest of China, which practices the usual precautions, which is to wash your hands, cover your mouth, and if you're sick, don't travel. In addition, Hong Kong may also be reducing and limiting traffic going into the city. This would not only reduce the risk of spreading the coronavirus, but would also help officials conduct more thorough checks of people passing through the borders. This could include interviews rather than relying on questionnaires, which could be falsified by just a tick. 7. Wuhan has been locked down. Wuhan, the city where the first case of the coronavirus was confirmed, has been in a complete lockdown starting January 23rd. Civilians are instructed to stay in their homes and not to leave the city. Airways and public transportations have been closed, as well as most businesses. But does it solve the problem? That seems to be a question that many on social media are asking. When the World Health Organization first received alerts of this new coronavirus on December 31st, it was thought to be pneumonia with no large-scale risk. So with confirmed cases in many other countries, who knows how many people from Wuhan have been carrying this virus, thinking they were fine before they started showing symptoms. To add to that, it's currently Chinese New Year's, where many travel to other countries to visit family and friends for the holidays. 8. A hospital just for this coronavirus will be built in 6 days. In response to the widespread panic, the city of Wuhan has begun building a hospital to treat the patients of the coronavirus. The hospital was planned to have a total area of 25,000 square meters and is expected to be completed in just 6 days from the start date, which was January 24th. That's an absolutely insane short amount of time. While they may have the materials for building, there is concern regarding the safety of the staff, regarding materials and safety equipment. Hospitals are currently asking for monetary donations, as well as donations for supplies. Another question many are asking is if one hospital will even be enough, with many civilians already flocking to the hospitals hoping to get checked up. 9. Things aren't as bad as they seem. Unlike the SARS epidemic, medical technology has improved greatly, and we're able to research and analyze diseases much quicker. Since the outbreak started, teams of scientists around the world have been working around the clock to analyze the coronavirus and develop treatments for the disease. From what we know about the 56 people that have been claimed by the coronavirus, the majority of them were elderly or had pre-existing health conditions, meaning they had weak immune systems. Combining that fact to what we know about coronaviruses, excluding SARS, they generally aren't that harmful. Take the common cold for an example. It's also a coronavirus, but if you're healthy, then you're likely to survive. 10. You can protect yourself. As we already know, This coronavirus spreads through sneezing and coughing. So if you hear about cases of the coronavirus in your area, you might want to start stocking up on face masks, washing your hands more frequently, and avoid touching your face, especially if you've been in a densely populated area, as it's more likely that you'll be in contact with somebody who has been infected with the virus already. And last but definitely not least, keep your immune system strong. Do your best to stay healthy with plenty of exercise and a healthy diet. A healthy immune system means that your body can fight off viruses and bacteria easier, making it less likely for you to get sick from this virus. I hope this video taught you more about the coronavirus and what's happening around it, and I'd really appreciate it if you left a like and subscribed for similar content in the future. That's all for this video and have a great day.